Hi, I'm Lori Byron, and this is our show called Our Planet, Our Health. I'm a pediatrician who cared for kids in the southeastern corner of Montana for several decades now.
And I'm Rob Byron, an internal medicine specialist who also cared for adults in southeastern Montana, and we're your co-hosts for this program. We feature conversations with Montanans from across the state, all of whom are working to protect our health and to make us more aware of the impacts of air pollution and climate change on our health.
So today we have Dr. Patricia Notraio from the Billings Clinic. She's a pediatrician, and she's also the upcoming president, currently the vice president of the Montana chapter of the American Academy of Pediatrics. So we like to start with people's beginning stories. Maybe that's because I'm a pediatrician.
Yeah.
But tell us what your childhood was like.
Thank you for having me on the show. My parents actually are both scientists, researchers focusing on what have become passion projects for them that they've really dedicated decades of their lives to. And they are both originally from outside the United States. So I grew up actually speaking Spanish. My dad's from Spain, my mom's from Peru. Speaking Spanish and then learning about all their scientific work at the dinner table. That's really what the conversations were about. I was really fortunate to receive education through various institutions that are mission-driven, really focused on and I'll tell you one of the goals of the school that I went to was a social awareness which impels to action. And that's really been a driving force for me and how I've ended up where I am. There were 5 goals, but that was one of the main ones that we focused on at my school, which was a K through 12, to the point that we would have 1 half day a week off to go into the community and serve. So I carried that with me into my college years and stayed, I was at Georgetown University and stayed there also for medical school. Georgetown's also very mission driven. And the motto that they have that really stuck with me was a life of the mind for the life of the world. And so both of those, I guess, missions or ethos have, they've inspired me to look beyond my job and see it really as a vocation. And I think that's really what has taken me to looking beyond the exam room for how I can help the community.
So, thank you for that. And
yeah.
So the next question comes up, why a pediatrician?
Yeah. I think I'm like many pediatricians who just have always liked kids. And that was really what drove me to pediatrics. Kids are usually pretty honest, and they really show you when things are not going well. And they're usually pretty resilient as well. So when they are feeling better, you know. I also see the role of a pediatrician as advocating for children and their families, which you can do and see over time when you are a general pediatrician working in an office, getting to know your patients from even before birth when their moms are pregnant, all the way through to when they finish high school or get a job or, kind of grow up. Yeah.
So you're raising 4 kids of your own right now and working as a pediatrician, which seems almost impossible. What sorts of things do you carry over from when you were a kid, like the things you did, the things your parents taught you that you think you're working with your kids now on?
Yeah. I have 4 boys. I think it's a little bit of maybe humor from whoever our creator is because I went to a all-girls school for 13 years. So I guess I put in my time with girls, right? But I was really lucky. The school that I went to was incredibly pro-curiosity, asking questions, supporting women in whatever career path that women wanted to choose. And so I'm really hopeful that I can teach my kids the importance of that, of being inquisitive, of wanting to learn more about where they live, and of being allies, not only to each other as siblings, but to people like women or those who really have not necessarily had as strong of a voice in society. I've tried teaching all of them Spanish, and then they get to a certain age and they go to school and they're surrounded by English, and so it gets a little harder as they get older. But I think bringing them different perspectives and different cultures is another way for them to hopefully enjoy curiosity about others and about where they live and who they encounter.
And what do you all do for fun?
Yeah. So my husband is actually from Billings. He grew up in Billings, and when we were finishing residency, which was in the Chicago area, and we had 2 kids and no family around, we really had to look to see where we would go next to have more support. And so really the decision was between the DC area where I grew up and Montana. And we really wanted our boys to have exposure to the outdoors, access to fresh air, access to a wide range of activities, particularly outdoor activities that they could enjoy and pursue probably more easily than you could in a large metropolitan area. Not to say that DC doesn't have wonderful things, and the kids actually get to take advantage of that every summer. They go spend the summers with my parents in the DC area. But we really felt like being in Montana would be a great way for the kids to appreciate the outdoors. So we enjoy hiking. We don't hunt, but we learned to fish because our kids want us to be real Montanans, so we had to learn some sort of outdoor skill. So we fish, and the most enjoyable activity for them, I think, is shed hunting. So we go into the Forest Service lands, or we walk around around the trails and see if we can find antlers. And they love that. They love that. Yeah.
So if we could shift a little bit, Patty, you mentioned both growing up, and you mentioned as one of the points that brought you into pediatrics, and that is advocacy.
Yeah.
So help our audience understand a little bit, what are some of the things that people can do as advocates, or what do you mean by advocacy?
Yeah, that's a really great question. I see the role of a pediatrician as someone who can bring to a family information, but who can also help shape and guide that family's development as a unit and how they will interact with their community. It's great because you can impact multiple people. By caring for the child, you're working with the caregivers, and so you can impact that family structure. But that's within one encounter, right? Within an exam room over time. And so there's multiple layers to that advocacy. So you can do it at a granular level with your patient and their caregivers, and then as a pediatrician, because sometimes children don't have anyone else who is working to support them, working to help them and be healthy and safe, which I talk a lot about in the office, you can then impact a whole community of children with partnership. I think the most effective advocacy is through partnership with others who might have similar goals. And so you can work with a school system, or you can work with family support groups in a community level, right? And what's really wonderful about Montana is there are very strong pediatrician advocates in the state already, just who they are. People who would like to contribute to the community beyond the exam room. And so then we have a beautiful statewide collaborative effort. And I speak from the vantage point of the Montana chapter of the American Academy of Pediatrics. There are incredible people in that group, and so it's been wonderful to be a part of that and see how individuals can work together to make impact for children. And together, I think we have a stronger voice. So for example, one of our pediatricians brought up that parents who care for children with medical complexity don't have a way to address the financial burden of maybe not being able to work outside of the home because they need to take care of their child, and brought up the idea of a piece of legislation in Montana that could help pay those caregivers, which usually you can't do until until the child's over 18. So partnering with pediatricians who could elevate the importance of health and safety for children, with families who were able to bring their children with medical complexity before the legislators and really demonstrate who they are as people, we were able to get that bill passed. And now parents of children with medical complexity who have Medicaid insurance or are on a waiver can get paid to care for their children. That's incredible. And pediatricians know how to bring people together and partner, because that's what we do in the office, so why not do it outside of the office? Yeah.
Terrific.
Yeah.
So now we have a new thing to advocate for in the medical fields with climate change.
Yeah.
Why do you think pediatricians care and should care?
Yeah, my hope is that, so I recognize that maybe the topic is new for many people because there's more urgency as we see the world be warmer, as we see the effects of pollution. But I think that this has been a very important topic for children for a very long time. I guess we're fortunate that probably most children aren't working in factories, at least where we live, although that may still be true around the world, right? So maybe the immediate exposures of things like factory-related pollution and things are less close to children, like maybe if you think about 150 years ago, for example. But I do think that making sure that children have an environment around them that promotes their health is huge. Green space. You know, having children in schools have access to green space for play, where they can breathe and have clean air to be breathing. I mean, that feels so basic, and yet I know it can be hard for communities sometimes to think about those aspects of building infrastructure. I'm going to go a little off tangent. I'll come back to what you said, because my brother actually is in commercial real estate and has really been driven to look at private-public partnerships to create space for people to engage with their communities in a way that promotes health. So similar ideas, right? Green spaces, healthy air, being able to play sports without having the car exhaust kind of blowing over to them. And so I think engaging with people within healthcare, but also engaging with people outside of healthcare who can share the vision of healthy spaces, that feels potentially new to some of our community members, and I think really worth thinking about. And my hope is that no matter what arena you're in, you can think creatively about how we can be better stewards of where we live. I grew up Catholic and still am trying to teach my children this, and the aspect of social justice in our faith, I think, is what also drives me to look at how we interact with our environment. And that doesn't necessarily have to come from a place of faith or religion, but I think sometimes people do need, what is their mission, right? How does taking care of the earth relate to their ultimate mission? And so I challenge people to think like that. I think that's really important. Yeah.
Well, thank you for making those connections to so many different aspects, and that is that it's not just about a medicine or a surgery or, say, a milestone. It's many other things of being able to get out and exercise safely, or just get out and interact with other people or interact with nature. All of those positively impact our health and certainly positively impact the world and the community as well. So thank you for that.
Can I actually add to what you just said?
By all means.
Yeah. So I really enjoy taking care of children with special healthcare needs. And I have a program specifically dedicated to children with medical complexity. And one of the things we talk about is that in caring for children with medical complexity, a lot of times we feel like we're having to react. We're having to react to the changes that they're going through and come up with reactive plans. But ultimately our goal is to be proactive and promote health stability through prevention. And I think from what I'm hearing from families is that's what we're looking for in healthcare, is how can we prevent problems instead of having to react to them, right? And sure, vaccines is one way we can do that, and having access to healthy places to exercise, right? Safe places to exercise is another. But thinking about what we put in our bodies, what we expose ourselves to in the air, for example, and how we care for the spaces we live in, that's one of the ultimate way for us to prevent problems, right, and to promote health. I say that from a place where I think sometimes people hear the words climate change and they go, oh, that's too much for me to think about right now. But I don't think that's true. And ultimately, if our goal is really to keep people healthy rather than just react to illnesses or acute conditions that arise, then we should all be thinking about the environment.
Thank you. Beautiful job. And that segues into my next question, which is a little bit related to healthcare professionals in our audience, but also to families. In Montana, for example, climate change is mostly manifested with things like heat waves, extreme weather events, and wildfires, among others, but those are some of the main ones. But when people come to see you, kids and their parents, how do you, it's hard when they come with so many other things that they want to address, but also as a pediatrician or physician, you want to address of the normal issues of growing up and being a teenager. Drugs, smoking,
sure,
violence, social issues. How do you integrate, I'll say, climate change or air pollution into all of that other in a single clinic visit or any given visit?
Yeah. I think that's a really great topic to bring up, because you're right, there's a limited amount of time that we have with each family in the office. And there's so many topics to cover. Injury prevention, nutrition, the things you were talking about. And so that's where building a long-term relationship with families is so beautiful. Because maybe at some of the appointments you really have to focus on nutrition, and you maybe don't focus on some of the other things as much. But maybe then when you see them again next time, you can talk about injury prevention. So over time you can build that relationship. And I've seen families bring information and questions to me that maybe relate to things like climate over time, because we've covered some of the other things, or because they feel more confident in their decisions or where to access information for some of the other topics. Sometimes I have an easy way in, because when we talk about things like asthma, triggers of asthma come up. Things like, wildfire smoke and exposure to cigarette smoke and things like this. That's like an easy way into that topic because it directly impacts their health. But it seems like families are really getting a lot more curious about prevention. And so nutrition comes up quite a bit. And so we can start to talk about where they're getting their food and how we can recycle, what about the containers that they're using? What are they putting food in to take to school? Is it plastic? I can start to make it relevant to them, which I think is the best way to help families feel confident in what they're doing with their kids, is finding a degree of relevance. Biking instead of using the car, or carpooling and things like this can come up. We have some great families in this local area that have a walking bus. So they all walk to school. And I think when kids see other kids doing that, then it seems really exciting. They want to do it too. We have a biking team in Billings, an interscholastic biking team that my kids got into. And now that's all they want to do is bike all across the city, which is great. It's ways that engage people, that meets them where they are, I think, that are really important. I almost wish I had more families asking about climate, and so and I don't, and that's okay, because then I can kind of introduce that as something to pique their interest, maybe make them more curious, ask questions, and be more socially aware, with the hope that they will then take some action.
Thank you.
Mm-hmm.
So what do you see with the Academy of Pediatrics doing in Montana related to the effects of air pollution and climate change on kids?
Yeah. From what I hear, so we have pediatricians across the state, usually concentrated in our more populated areas in Montana. So there are actually primary care kids who see someone, let's say for a nurse practitioner, a PA, a family practice physician, in their local community, because they don't necessarily have pediatricians everywhere. And so I admire the efforts to collaborate across healthcare organizations. So the Montana Academy of Family Practice, the Montana Medical Association that does a lot of legislative advocacy, Montana AAP. And I have really appreciated the fact that Montana AAP is really trying to attract people from other healthcare organizations to attend educational conferences or webinars, to sign up to be on our newsletter, because I think that's important. Families can choose a wide range of people that they're going to see for primary care, and so if we can engage all of those individuals, I think we can have a much better reach and more impact. Montana AAP has also committed to hosting specific speakers related to climate at some of our educational conferences, and I think that's important. One way that we tried to integrate this in our educational conference last year was actually having all of the speakers find a link to climate change and incorporate that into their talks, even if it wasn't specifically a talk on the climate health. And that can give pearls to our pediatricians to bring up with their families that engage them where they are. So I think that's really important. I have also appreciated having things like books that we can give to families. There's a book about chameleons that we were able to get through a partnership that we can get kids interested in and have talking points about. So I think a multi-layer approach can create more impact as well. So,
fantastic answer.
Yeah, thank you. And Patty, you've done a beautiful job of connecting so many different aspects of health. It's not all about climate change, or it's not all about whether you smoke or not. It's not all about any one thing, but all of these can impact our health, especially if we can find positive actions of ways to integrate them into our lives and others. So we're getting pretty close on time. Mm-hmm. So for our audience, what are 2 or 3 highlights of things we've talked about today that you would like our audience to take away from our conversations today?
Yeah. I would love for people who are watching this to think about their community and be able to look at it as someone who could contribute. It doesn't have to be big, but I think being aware and connecting with others who are also aware of the community and what it could be can help drive action, because we really don't live in isolation. So I think that really gets back to that goal of like social awareness that impels to action. I'd love to see people connect just on the basis of humanity, that we are all kind of in this together, and find ways to help the group. I think it's easy to consider what only affects us and what we want to accomplish as individuals. But if we all did that, what would we be? So I think that's one. The other is that children are worth fighting for. They're our future. And while every adult was a child, not every child will become an adult. And we, as grown-ups, are positioned in a place where we could really lift up the voices of youth and hear how we can design their future so that it is healthy and it is safe. I know pediatricians do that quite a bit, and parents do that for their own, caregivers do that for their own children. And so I'd really like to make sure that we put kids, at least give kids a seat at the table for every conversation.
Can't get better than that.
Yeah, fair enough.
Thank you very much.
Yeah, of course. This has been great. Thank you.
Thank you.
Thank you.
Yeah.